Hello, everyone. My name is Dr. Christy Plunk. I'm a physical therapist and board certified in women's care. I'm super excited to be able to share with you guys today a little bit of info on pelvic floor protection, kind of muscle protection, muscle things that we can do during pregnancy and after to help us recover. I have a private practice in Bedford. We specialize in women's health. I opened in 2012 with the plan to focus on women's needs more specifically. We have 9 therapists. We have 7 private treatment rooms because a lot of the type of treatment we do does require something more than just an open gym. And so I am really excited to share with you today. So I'm going to hit some highlights today. We're going to talk about isolating and engaging the pelvic floor muscle function during pregnancy and postpartum, and then prolapse prevention and management, diastasis recti, so that abdominal muscle separation, prevention and treatment, and then a little bit on bladder leakage, what we can do for it, what you can do at home, how quickly can you start working on that. So the pelvic floor holds multiple functions. It's a sling that is in the bottom of the pelvis, and it supports key organs, bladder, uterus, rectum, and it's essential for urinary control and bowel control. It plays a vital role also in core stability, so the pelvic floor should automatically co-contract with some abdominal muscles to make us able to run, jump, do all the normal things without losing continence. So very important that the abdomen and the pelvic floor work together. And the pelvic floor in and of itself, because it has so many functions, it is a unique set of muscles and tissues in that it has to be very flexible for childbirth and intercourse, but it also has to be strong. But whenever you get flexibility, you also have the risk of too much laxity or too much weakness. So with pelvic rehab, we really work to walk that bridge between flexibility and strength. So looking for a pelvic floor therapist might be in your future. The pelvic floor therapist, you want to look for somebody who has specialized training in pelvic rehab. So pelvic rehab is not something that we learn in physical therapy school. We learn how to treat muscles and nerves, but we're not specific to the pelvic floor. So you would want to have somebody that has gone to extensive training and knows how to do the specific rehab that is necessary. We work to restore the muscle and the nerve function through the pelvic floor and the core. Treatment might include manual therapy, scar tissue mobilization, whether there's tearing, an episiotomy, or a C-section scar. Those scars can be tender. We work to get those softer, more flexible so that they are not a hindrance going forward. We talk you through exercise progression, help you progress, get back to what you were doing before baby or before pregnancy, and then talk to you about body mechanics, so the things that you may be doing that may be contributing to some of your symptoms. Coordination training is actually very important in the pelvic floor, so pelvic floor has to be able to fully activate and fully relax. And then we talk to you about any lifestyle modifications, if there are foods that are contributing, talk to you about bowel habits, urinary habits, anything that impacts the pelvic floor, we're going to most likely have a discussion about. So what is the pelvic floor? The pelvic floor is at the base of the pelvis. It's all of the soft tissue between the pubic bone and the coccyx. It's kind of like a hammock. There are 3 holes in the pelvic floor for females and 2 holes for males, which is also one of the reasons why the pelvic floor in females is more flexible, but also we tend to have more issues than males just because there's 3 openings instead of the 2 that they have. To engage the pelvic floor, it'll feel like a gentle lift up the muscles in this area. So if you're feeling like a lot of tension through your abdomen or your glutes, you're probably not isolating those muscles fully. And sometimes the muscles are so weak that it takes supporting muscles to get some activation. But our goal when we're retraining the pelvic floor is to really get those muscles strong and powerful independently. Relaxing the pelvic floor is actually just as important as activating. So we need the muscles to be able to move through their full range of motion. So fully activate for that continence, fully relax so that we are non-painful with daily activities, penetration, anything like that. And also being able to fully empty bladder and bowel requires full pelvic floor relaxation. The pelvic floor is actually a stress responder. So we may be clenching the pelvic floor without even realizing it, and that can lead to some overactivity. So that is definitely something that we take a look at. All right, how to test activation. Now, you can do the urine flow stop test just as a one-time thing. Give it a try, see if you can stop the flow of urine. Those are the muscles that are the pelvic floor. It takes a moderate amount of strength to be able to do that. So if there's a little bit of weakness, that might not be possible for you. I do want to give the caveat that you don't want to do this regularly. Don't do this as an exercise because it can cause the bladder to not fully empty, kind of lead to other problems and irritation if that's done regularly. So okay to do it as like a test here, there, but you don't want to do that regularly. Some external cues, you can imagine pulling a tissue into the vagina, pull up and in. Sometimes I say like you're sucking a straw through the vagina. Pull the coccyx to the pubic bone. You can also think about lifting a blueberry or a marble with the vagina. And then sometimes just taking the focus and thinking more about squeezing around the anus can get a good pelvic floor contraction as well. It is the same muscle that goes around the vagina, urethra, and anus, if you recall me saying that, the 3 holes. And so you can kind of shift that focus back and think about contracting around the anus for a little bit stronger contraction in some cases. All right, common mistakes would be overusing the glutes or the inner thighs. We want the pelvic floor to work independently, so that would be the goal. The belly should be moving with your breath. So inhale and exhale, even if you're pulling in your pelvic floor, you should still have that natural movement of your belly for breathing. And then again, we want to talk about making sure that you're relaxing after you activate and not staying completely clenched. All right, so pelvic floor muscle function during pregnancy and postpartum. So what does pregnancy do and how does that impact? So increased weight from the baby definitely adds pressure to the pelvic floor. So the pelvic floor is being asked to do quite a bit more. There's a lot more blood flow to the area. Sometimes the veins are kind of compressed, so we might get a little bit more vein dilation to the area, which can cause just a little more discomfort and maybe make the muscles even a little bit more sluggish. And then from the hormones, we have more ligament laxity, more flexibility in the pelvic organs, even in the pelvic floor. And then we need those muscles to be nice and strong to be able to support during the pregnancy. But going into delivery, that it's very important to have that understanding of how to let the muscles relax and have an effective pushing mechanism. We want to balance strength and relaxation of these muscles. So the strength is really important for continence during pregnancy and just staving off some aches and pains that are going to accumulate with pregnancy, but don't have to be limiting. They don't have to stay and just get worse and worse and worse as your pregnancy progresses. We certainly can address those muscles during pregnancy to make sure that you can live life and do all the things you need to do while growing a baby. And then appropriate exercise during pregnancy. Now, if you were doing, endurance athlete type things, then, of course, you're going to talk to your OB or your midwife about, the safety of that and how long you can continue that into your pregnancy. But generally speaking, we want to focus on transverse abdominis strengthening during pregnancy with the pelvic floor. The transverse abdominis muscle is also called the corset muscle. The fibers lay this way in our abdomen, whereas the superficial muscles lay this way. And these can get separated, but if we have a tight transverse abdominis, then it takes some pressure off of the rectus abdominis and can decrease the risk of that diastasis recti. It's also important to strengthen the back. So the shoulder retractors, being able to pull the shoulder blades back and hold baby, are really important in that postpartum period. And that can start during pregnancy, and make that a little bit smoother. All right, so postpartum muscle recovery expectations. So as you know, a delivery is quite traumatic to the pelvic floor. Um, the muscles are often weakened after delivery, after vaginal delivery, even after a C-section, just because the muscles have been working overtime to support baby and the pelvic organs above. So the pelvic floor does, in general, just need some time to regain function. So it's important to not jump back into heavy lifting routines, or even some of the housework that puts a lot of pressure on the pelvic floor and increases abdominal pressure. You'll want to be aware of that. It is very common that women that have vaginal deliveries also have a little bit of prolapse. So most of the time, the midwife or the OB isn't necessarily going to mention the prolapse unless you start complaining of symptoms. But the presence of a little bit of laxity on the vaginal walls, especially on the front part of the vaginal wall where the bladder and the urethra are, very, very common with a vaginal delivery. Which also is why it's important to go ahead and rehab your pelvic floor after deliveries. You can begin pelvic floor activation as soon as the day after a delivery. You would want to do just short activations, just real nice, gentle, short activations, get some blood flow to the area. This can help move out some swelling in the area and just remind the muscles, hey, here we are. Help us out with continence and kind of retrain some of those. Sometimes the baby coming through the birth canal can also stretch the nerves a little bit, further making the muscles a little bit sluggish. So that early onset of just telling those muscles, sending some signals to those muscles, can be very, very helpful. So prolapse prevention and management. So what is pelvic organ prolapse? This is where the bladder, the uterus, or the rectum can kind of fall into the vaginal canal. Just because it's there doesn't mean that you're going to need surgery. There's definitely stages of it, and like I said, most women have a little bit if they had a vaginal delivery. The key is making sure it doesn't progress and doesn't get any worse after that vaginal delivery. If a prolapse is present, keep in mind that if you're breastfeeding, then the ligament laxity hormones will continue for up to a year after you finish nursing. So it can take a little while for these ligaments to return to the pre-pregnancy length and stability. So you want to keep that in mind, even through your breastfeeding stages. Prolapse is caused from excessive force through the pelvic floor. So generally this is pushing during delivery, although it can also be caused by constipation. Signs of this would be heaviness, pressure, even a bulging out of the vagina, or an aching sensation. Sometimes if there's a rectocele, it can be difficulty fully emptying stool. Even if the stool is not hard, like a difficulty emptying it, stool can sometimes kind of get stuck in a little bit of a pocket that kind of pushes forward into the vaginal canal. Again, none of this is like, you got to go have surgery. It's just, let's figure out how to retrain our bodies, get the stability back, and any laxity that's there is not impactful. So prevention strategies during pregnancy and postpartum. Proper lifting mechanics. So exhaling whenever you lift can help you engage your pelvic floor more. Just not lifting heavy things also helps for a period of time until that pelvic floor is retrained. Avoid constipation. Make sure you're getting enough water and fiber. And then for a lot of people, that squatty potty, so that little step that goes around the potty, will get you into the squat position so that you can empty easier. Also want to talk about avoiding intra-abdominal pressure. So lifting nothing heavier than baby, not doing sit-ups or crunches in the early postpartum period as well. And then what are we going to do with treatment of prolapse? So you can start with just some gentle pelvic floor activation, like I said, in the hospital. Think about engaging your pelvic floor every time that you pick up baby. Address the posture, make sure with baby, we can kind of tend to like hold baby and kind of sit back on our hips and push our hips forward. This can add more pressure to the pelvic floor. So making sure that even when we're holding baby, we're engaging the core and really using our trunk muscles to be supported. And then, if things are persisting, you're like, it's not recovering the way that I feel like my body needs to, then certainly come and see us. Or even if you need you're like not sure where to start, you're like, I don't know if I have prolapse or not, I don't know if my muscles are working, of course, find a pelvic floor PT. All right, so going on to diastasis recti. So this is the separation of those abdominal muscles. As I said before, diastasis recti is the separation of rectus abdominis muscles out to the side. There's a thin line of fascia in the center, linea alba, that typically gets thinner as the muscles spread apart. So what do we do to combat this? This is extremely common in pregnancy. It does happen as well in obesity, but in terms of pregnancy, most women get some diastasis recti during their pregnancy, and that's completely fine. We rehab it and get those muscles back to where they need to be. A focus on transverse abdominis strengthening and pelvic floor activation helps take some pressure off of those superficial muscles here that are separated, take some pressure off of them so that they can go back together. And in that phase, in that postpartum phase, we do want to avoid twisting and rotation, because that adds more shearing to these muscles that are already stressed. So turning towards baby to pick up, making sure that you're facing hips and shoulders are even with picking up baby is really important to take pressure off and allow those muscles to come back together. Let's see, I'll go to the next slide and talk about how to assess for it. So if you can lay on your back and do a little curl up. If you see like a line, a bulge, a line in the center of your abdomen, then that certainly is a diastasis. It's not always that obvious. You can take your fingers and feel, and you should feel the ridges of the muscles where they are, and then it'll be softer or thinner in between the muscles. And that'll give you an idea about whether you've got diastasis, how severe it is. As far as adding in exercises and being careful or protecting your diastasis, if you're doing the exercise and that line bulges out or your abdomen is bulging with the exercise, it's probably not a good time for you to do that exercise. You need a little more transverse abdominis strengthening, a little more coordination in that core to safely return to that exercise. All right, so just continuing on with things to avoid with the healing of diastasis, or even during pregnancy, trying to minimize the diastasis. You want to avoid crunches or sit-ups. If you're strengthening your core, generally it's safer for your core to stay flat, so it's not curling up. Maybe your legs are moving on your core, your arms are moving on your core, but you're not moving the core necessarily. That's a safer type of exercise when we're talking about diastasis recovery. Even excessive extension can strain that linea alba, that fascia, and hinder some recovery. So keep that in mind. And again, just watch for doming of the abdomen. When you're doing any exercises and the abdomen is involved, the abdomen should actually flatten slightly if the transverse abdominis is activating correctly. If it's got that bulge, work on TA a little bit more, come see a therapist, and get that coordination back and that strength back. All right, managing bladder leakage. So this one is super common. Just because you've had a baby doesn't mean you have to pee when you jump. Um, the key is getting the strength back and the coordination back. So causes of bladder leakage, just the stretch in the pelvic floor, causing some weakness, and then also it's that prolapse is common. Kind of two different types of incontinence. There's stress incontinence, which happens when you're coughing or sneezing, laughing, or jumping. And then there's urge incontinence, which means you can't hold it. You've got the urge to go, and you're like, I can't quite get there. And you get a little bit of leakage on the way. So that would be urge incontinence. We treat them both generally, both of them are going to have similar training patterns. But some of the coordination stuff that we do, some of the behavioral recommendations that we make are a little bit different depending on which type of leakage is happening. And sometimes both are there, but that stress incontinence is definitely the most common one. And then what can we do to prevent bladder leakage? Definitely starting those short activations, telling those muscles to activate, reminding them what they're supposed to do soon after delivery is helpful. Be really careful with long holds initially, so we don't want to add soreness and irritation to the muscles, but certainly turning those muscles back on and getting them to activate, especially during a cough or a sneeze. There is a reflex in the pelvic floor that causes the pelvic floor to activate with a cough or sneeze or something, an increase in intra-abdominal pressure. However, when baby passes through the vaginal canal and stretches all the nerves and the muscles, that reflex is lost. So it takes a little bit of effort, a little bit of brain power to retrain that reflex so that the pelvic floor starts automatically kicking in again. So you want to see a pelvic floor therapist if your leaking's not improving, symptoms are worse, you're just not happy with where you're at, or if you're having trouble with even emptying your bladder or your frequency of urination is too high. All right, so key takeaways. It's important that the pelvic floor has a nice balance between strength and flexibility. So being able to generate good, strong power when we need to, but then also be able to relax and even correctly bear down is really important as well. In the early postpartum period, really work on protecting the pelvic floor. Even during that nursing period, there is just an increased risk of a prolapse possibly progressing if you're doing too much lifting too early without proper pelvic floor support. So certainly want to get that in, get those muscles retrained early in that postpartum period. And then if you are, just having things that you're not comfortable with in the pelvic floor, talk to your OBGYN, your midwife, and check out a pelvic floor therapist. The key thing to keep in mind is that our bodies do amazing things. It's really incredible that we can grow babies and push them out of us and then take care of those babies. We're just incredibly made. And mothers are certainly everyday superheroes. Best job in the world, hardest job in the world. Congratulations, moms.